Occasional 3 a.m. awakenings are normal, especially as we age, but when they happen consistently and interfere with overall well-being, they may be a warning sign that something more serious is going on. The body often communicates health issues through sleep disturbances, and seniors should pay close attention to these signals rather than dismissing them as just aging. One red flag is the presence of chronic insomnia, difficulty staying asleep more than 3 nights a week for several months. Persistent 3 a.m. wake-ups may indicate underlying conditions such as sleep apnea, heart problems, diabetes, or thyroid disorders. For instance, repeated awakenings combined with snoring or gasping for air strongly point to sleep apnea, which increases the risk of hypertension, stroke, and heart disease if left untreated. Similarly, sudden nighttime awakenings accompanied by sweating or irregular heartbeat may suggest cardiovascular concerns. Mental health warnings should not be overlooked either. Consistently waking in the early morning hours is often associated with clinical depression. Unlike temporary stress-related insomnia, depression-related awakenings are typically paired with feelings of hopelessness, low energy, and lack of interest in daily activities. Ignoring these signs can worsen both mental and physical health. Another reason to take notice is when 3 a.m. awakenings lead to daytime impairment. If broken sleep results in fatigue, memory lapses, mood swings, or increased risk of falls, it's not just a nuisance, it's a danger to independence and quality of life. Poor sleep weakens the immune system, raises inflammation, and accelerates cognitive decline, all of which can shorten lifespan if not addressed. In such cases, it's important for seniors to seek medical evaluation. A doctor can check for hidden health conditions, review medications that may be interfering with sleep, and recommend solutions ranging from lifestyle changes to therapies. Sometimes, something as simple as treating nocturia or adjusting medication timing can resolve the problem. In other cases, a sleep study or specialist consultation may be necessary. Ultimately, consistent 3 a.m. awakenings shouldn't be ignored. While some disruptions are part of normal aging, frequent early morning wakefulness may be the body's way of signaling deeper health issues. Recognizing when it crosses the line from normal to warning sign is crucial for maintaining long-term health, independence, and peace of mind. While biological and medical factors often play a role in seniors waking up at 3 a.m., the sleep environment and daily habits can be just as influential. A poor sleep setting or certain lifestyle patterns can keep the brain from staying in restful sleep, leading to those frustrating early morning awakenings. The bedroom environment is one of the first things to consider. Older adults are more sensitive to noise, light, and temperature changes than younger people. A ticking clock, a street light through the window, or even a slightly warm room can be enough to disrupt sleep. Since aging often leads to lighter sleep stages, these small disturbances can easily wake someone around 3 a.m. Investing in blackout curtains, a supportive mattress, or a white noise machine can help create a more restful atmosphere. Lifestyle habits also have a huge impact. Many seniors fall into irregular sleep schedules, napping long hours during the day, going to bed too early, or watching TV late into the night. These behaviors confuse the body's internal clock, making it harder to stay asleep through the night. Similarly, caffeine or alcohol consumption later in the day can interfere with the brain's ability to maintain deep sleep. Even a cup of tea or coffee in the afternoon can linger in the system long enough to trigger nighttime restlessness. Lack of daytime physical activity is another factor. Seniors who are less active may not build up enough sleep pressure, the natural drive that helps the body crave rest at night. As a result, they may fall asleep quickly but wake in the early hours because their body hasn't truly expended enough energy. Gentle exercises like walking, stretching, or yoga can strengthen this sleep drive. Even bedtime routines play a role. Using phones or watching TV before bed exposes the brain to blue light, which suppresses melatonin production. This makes it more likely that sleep will be shallow and easily broken. On the other hand, calming pre-sleep rituals such as reading, meditating, or drinking a warm, non-caffeinated beverage can help signal the body that it's time for continuous rest. In many cases, fixing the sleep environment and lifestyle habits can reduce 3 a.m. awakenings significantly. Seniors who create a consistent bedtime routine, adjust their environment for comfort, and stay active during the day often find themselves sleeping more deeply and waking up feeling refreshed. For many older adults, the reason they find themselves wide awake at 3 a.m. isn't just physical, it's emotional. Stress, anxiety, and overthinking are powerful disruptors of sleep, and they often intensify with age. Seniors may appear calm on the surface, but nighttime can bring a flood of worries that make restful sleep impossible. One major reason is the quiet of the night itself. During the day, distractions keep the mind busy, but in the stillness of 3 a.m., unresolved thoughts and concerns rise to the surface. Seniors often worry about their health, finances, or family members, and these thoughts can spiral into full-blown anxiety when they're alone in the dark. This mental activity stimulates the brain, making it difficult to relax and drift back to sleep. Physiologically, stress triggers the release of cortisol, the body's stress hormone. Cortisol naturally rises toward morning to prepare the body for waking, but in anxious individuals, it spikes earlier and higher than normal. This premature surge can jolt someone awake at 3 a.m., leaving them alert and restless instead of drowsy. Chronic stress also interferes with the production of melatonin, further disrupting the body's natural sleep rhythm. Emotional struggles like grief, loneliness, or depression, all common among seniors, add to the problem. The loss of a spouse, reduced social connections, or feelings of isolation can weigh heavily at night. These emotional burdens not only trigger awakenings but also make returning to sleep far more difficult, as the mind loops through painful memories or anxious scenarios. Unfortunately, this creates a cycle. Waking up in the middle of the night causes frustration, which leads to more stress, which makes it even harder to sleep. Over time, seniors may begin to fear nighttime awakenings, increasing anxiety further and deepening the problem. Managing nighttime stress and overthinking requires both practical and emotional strategies. Relaxation techniques, such as deep breathing, meditation, or listening to calming music, can help quiet the mind. Journaling before bed to empty out worries also reduces the tendency to ruminate at night. Staying socially engaged and seeking emotional support from friends, family, or professionals can lessen feelings of loneliness that fuel nighttime anxiety. Most importantly, seniors should remember that waking at 3 a.m. due to emotional stress isn't a personal failing, it's the body's response to unresolved feelings. With the right coping tools, it's possible to calm the mind, lower stress hormones, and restore deeper, more peaceful rest. Sometimes, waking up at 3 a.m. isn't just about age-related changes in sleep patterns, it can be a sign of underlying health conditions that quietly interfere with rest. For many seniors, these hidden issues are the real reason behind disrupted sleep, even when bedtime routines and habits seem healthy. One of the most common culprits is sleep apnea, a condition in which breathing repeatedly stops and starts during the night. Many older adults may not even know they have it, but their body awakens multiple times in the early morning hours to restore normal breathing. This leads to fragmented, shallow rest, often without the person realizing the cause. Similarly, restless leg syndrome (RLS), or periodic limb movement disorder can trigger discomfort and unconscious movements that wake the sleeper. Chronic pain is another powerful disruptor. Conditions such as arthritis, back pain, neuropathy, or fibromyalgia often intensify at night when the body is still, making uninterrupted sleep nearly impossible. For some, this pain reliably wakes them in the early hours, leaving them tossing and turning in discomfort. Other systemic health problems can also contribute. Heart disease, diabetes, and thyroid disorders are known to affect energy balance and sleep regulation. Low blood sugar during the night, for example, can cause sudden awakenings accompanied by restlessness or even mild anxiety. Similarly, heart-related issues may trigger shortness of breath or irregular heartbeats that wake seniors around 3 a.m. Mental health plays a quieter but equally important role. Depression and anxiety are strongly linked to middle-of-the-night awakenings. Depression often shortens the time spent in deep, restorative sleep, while anxiety can trigger racing thoughts that make it hard to fall back asleep once awake. Unfortunately, older adults sometimes dismiss these conditions as just part of aging, when in reality, they are treatable contributors to poor sleep. The danger of ignoring these health issues is twofold. Not only do they rob seniors of restorative sleep, but they may also indicate more serious underlying conditions needing attention. For example, untreated sleep apnea increases the risk of high blood pressure and stroke, while persistent insomnia may weaken immunity and cognitive function. The key is not to accept waking at 3 a.m. as just aging. If it's frequent and persistent, it's worth seeking medical evaluation. Identifying and treating hidden health issues can restore not just better sleep, but also overall well-being, energy, and longevity. For many older adults, the reason they wake up at 3 a.m. isn't simply aging, it's the medications they take. As people grow older, they're more likely to manage multiple health conditions such as high blood pressure, heart disease, diabetes, arthritis, or anxiety. Each of these may require daily medication, and while these drugs are essential for health, many come with side effects that disrupt sleep cycles. Some medications act as stimulants or interfere with the brain's natural chemistry. For example, corticosteroids, used for inflammation and arthritis, can cause restlessness and insomnia. Beta blockers, common for heart conditions, are known to suppress melatonin production, making it harder to fall and stay asleep. Even certain antidepressants, while helpful for mood, can reduce REM sleep or trigger middle-of-the-night awakenings. Diuretics, often prescribed for high blood pressure or heart failure, are another major culprit. They increase urine production, which leads to more frequent bathroom trips, often right around the middle of the night. This not only interrupts sleep but can also make it harder to get back to sleep once awake. The challenge for older adults is that the body processes medications differently with age. Kidney and liver function naturally decline, meaning drugs may stay in the system longer than intended. This can amplify side effects, including sleep disturbances. Even medications that don't typically affect younger people's sleep may have a much stronger impact in seniors. On top of that, many seniors take multiple medications at once, a situation known as polypharmacy. The combined effects can create a cycle of fatigue during the day, difficulty falling asleep at night, and early morning awakenings. For instance, a senior may take a pain reliever that causes drowsiness in the evening, but a blood pressure pill that interrupts sleep hours later. Managing this issue requires careful balance. Seniors should never stop medications on their own, but it's wise to discuss sleep concerns with a healthcare provider. Sometimes, adjusting the dosage, switching to a different medication, or simply changing the time of day the drug is taken can improve sleep dramatically. In some cases, adding non-drug approaches, like relaxation routines, exercise, or light therapy, can counteract medication-related sleep disturbances. In short, medications can be life-saving, but they can also quietly sabotage sleep. For older adults waking up consistently at 3 a.m., it's worth asking whether the very pills keeping them healthy are also robbing them of rest. One of the most common, and often frustrating, reasons older adults wake up at 3 a.m. is nocturia, the medical term for frequent nighttime urination. While waking up once in the night to use the bathroom is fairly normal, many seniors find themselves making multiple trips, and these interruptions can seriously disturb sleep quality. As we age, several factors contribute to nocturia. First, the bladder's capacity naturally decreases, meaning it holds less urine than it did in younger years. At the same time, the bladder muscles can become weaker, making it harder to fully empty the bladder during the day. This increases the likelihood of needing to urinate more often at night. Another key factor is the decline in antidiuretic hormone, ADH, production. ADH helps the kidneys retain fluid, reducing the amount of urine produced during sleep. In younger people, higher nighttime ADH levels mean less urine is created while they rest. But in older adults, reduced ADH production results in the kidneys continuing to produce significant amounts of urine overnight, forcing more frequent bathroom trips. Medical conditions can also play a role. Enlarged prostate, BPH, in men, overactive bladder, urinary tract infections, diabetes, and even heart conditions can increase nocturia. Certain medications, especially diuretics for blood pressure, also contribute to nighttime urination. For many seniors, it's not just the urge to go, but the difficulty of falling back asleep afterward that leads to those frustrating 3 a.m. awakenings. Beyond the direct sleep disruption, nocturia carries other health risks. Each bathroom trip involves getting out of bed in the dark, which raises the chance of falls and injuries, especially for older adults with balance issues. Over time, poor sleep caused by nocturia can also affect mood, memory, and daytime energy. Managing nocturia often requires lifestyle adjustments. Limiting fluid intake in the evening, especially caffeine and alcohol, can make a big difference. Ensuring good bladder health, practicing pelvic floor exercises, and discussing medication timing with a doctor may also help. In more severe cases, medical treatments or therapies may be needed to reduce symptoms. Ultimately, frequent 3 a.m. awakenings due to nocturia are not just a minor inconvenience, they're a signal from the body that something may need attention. By addressing underlying causes and making small lifestyle changes, seniors can reduce nighttime disruptions and reclaim more restful, continuous sleep. Another key reason older adults wake up around 3 a.m. lies in the natural decline of melatonin and other sleep-related hormones. Melatonin is often called the sleep hormone because it plays a central role in signaling to the brain that it's time to rest. It's produced in the pineal gland, primarily in response to darkness, helping the body transition smoothly into sleep and maintain rest through the night. As we age, however, the production of melatonin gradually decreases. Studies show that seniors produce less melatonin at night compared to younger individuals, and the release pattern becomes irregular. With lower levels of this hormone, the brain receives weaker signals to stay asleep, which often leads to waking up during the early hours, commonly around 3 a.m., when melatonin levels dip further. This makes it difficult to fall back into a deep, restful sleep. But melatonin isn't the only factor at play. Cortisol, the body's stress hormone, naturally rises in the early morning hours to prepare us for wakefulness. In older adults, this increase sometimes happens earlier than usual, causing the body to shift into a more alert state prematurely. Combined with low melatonin, this hormonal imbalance nudges seniors out of sleep much earlier than they'd like. The decline in growth hormone and changes in estrogen and testosterone levels with aging also subtly influence sleep cycles. Growth hormone, which is linked to deep sleep and nighttime restoration, drops significantly in later years, making sleep lighter and more fragmented. Without the stabilizing effect of these hormones, older adults become more vulnerable to nighttime awakenings. Environmental and lifestyle factors can magnify the problem. Reduced exposure to natural light, which is necessary for regulating melatonin production, often worsens hormonal imbalance. Evening habits such as bright indoor lighting, late-night TV, or phone use suppress melatonin even further, setting the stage for restless nights. Understanding this natural hormonal decline helps explain why waking at 3 a.m. is so common in seniors. While aging makes these changes inevitable, the effects can often be managed. Simple strategies like reducing evening light exposure, avoiding caffeine late in the day, and creating a calming bedtime routine can help the body optimize whatever melatonin it still produces. In some cases, doctors may recommend melatonin supplements, though they should be used carefully and only under guidance. In short, the decline of melatonin and other sleep hormones is a normal part of aging, but it doesn't mean seniors must resign themselves to poor sleep. With the right habits and medical support, it's possible to minimize those 3 a.m. awakenings and restore a more restful night. One of the main reasons older adults often find themselves waking up around 3 a.m. is the natural shift in the body's circadian rhythm, the internal biological clock that regulates when we feel awake and when we feel sleepy. This rhythm is controlled by a tiny part of the brain called the suprachiasmatic nucleus, SCN, which becomes less efficient with age. As a result, the signals that once kept sleep cycles consistent start to weaken. In younger adults, the circadian rhythm typically encourages deep, restorative sleep during the night and alertness during the day. But for seniors, this rhythm shifts forward, a phenomenon sometimes called phase advance. That means older adults may feel sleepy much earlier in the evening, often around 8 or 9 p.m., and then naturally wake up earlier, sometimes in the very early hours of the morning. This explains why many seniors are wide awake at 3 a.m. while the rest of the household is asleep. This shift doesn't just affect sleep timing. It also affects sleep quality. The proportion of deep sleep, also known as slow-wave sleep, tends to decline with age, while lighter stages of sleep increase. Because light sleep is more easily disrupted, seniors are more prone to waking up multiple times throughout the night. Once awake, many find it hard to fall back asleep because their circadian rhythm is no longer aligned with longer nighttime rest. External factors can make this even worse. Natural light exposure, which helps regulate the circadian clock, often decreases in older adults, especially those who spend more time indoors. Without enough daylight, the body's sleep-wake signals become weaker, leading to fragmented sleep. Add in evening habits such as watching TV or using phones, and the circadian rhythm becomes even more disrupted. While waking at 3 a.m. may feel frustrating, it's not always a cause for alarm. It's often a natural outcome of the body's changing rhythm. However, consistently broken sleep can leave seniors feeling fatigued, irritable, and mentally foggy during the day. To manage this, experts recommend getting more morning sunlight, staying active during the day, and keeping a consistent bedtime routine. These habits help reinforce the circadian rhythm, making it easier to stay asleep longer and wake up feeling refreshed.